organisms that you would be looking at.
Right, right.
The longer you're in a healthcare setting, you know, increases the risk significantly.
Right. All the more reason, aside from insurance companies that may want us
getting out of the hospital
get out of
quickly.
the hospital. That's right. Reduce your risks. Now, is there anything in particular that hospitals are doing differently now to reduce that risk of infection occurring?
Well, certainly all the education we do to all of our staff, physicians, nurses, any healthcare worker on hand hygiene, getting lines out quicker, reviewing every day with the physicians. The nurses should be reviewing whether the line is still needed. Do you still need a Foley catheter? There are many initiatives to try to get those lines out so that everybody's on the same page. You know, don't leave a line in longer than it's absolutely necessary.
Right.
Every day increases the risk of an infection.
Okay. Now, those points that you've mentioned are clearly well known and well understood by the healthcare side of it, by the healthcare professionals, but is there anything in particular that a patient should do before they're going into a hospital to be kind of tuned into that sort of information, like things they might be able to prepare for to help reduce their risks before they come in?
Well, certainly if you're going in for surgery, there are some things you can do. One thing is that a patient should not shave the area preoperatively at home because that increases your risk of developing an infection post-surgery.
Because of the cuts,
the nicks and the bacteria, your regular staph that we frequently carry gets into that and sets you up for an infection after surgery. Other things you can do are taking showers, you know, for usually the day or two prior with a soap called chlorhexidine. It's an antibacterial soap. It helps decrease the bacterial count that we carry on our skin. Making sure that you get your pre-op antibiotic on time within an hour of surgery. Very important that you make sure if you haven't gotten it before they put you to sleep that you ask about it. It needs to be in within 60 minutes of the surgeon cutting. Stopping the antibiotic at 24 hours because you don't want to increase the use of antibiotics. So for prophylactic antibiotics to help prevent an infection, you need to stop them at 24 hours. Excellent tips. And we will be sure to be having all of this information posted on our website as well for viewers who may want to really read more into this. Thank you so much, Pat, for sharing this information. I know that there is some new legislation happening that's impacting hospitals, and maybe I know that our next guest, Corey Robertson, has also been involved with that. So, Pat, maybe you can share a little bit on that legislation. There is a new MRSA bill that passed and was signed 2 months ago by Governor Corzine, and that's requiring hospitals to start to screen patients, especially high-risk patients, as they come into the healthcare setting. And the purpose of that is to identify your colonized, those patients who aren't sick with the organism, MRSA, but who may have it and who can act as a source of infection to other patients. And so the thought is that if you can identify the person who's carrying the organism and put them on proper isolation precautions, reminding staff that this patient has a form of bacteria that can be easily taken to other patients, that place them on isolation so that staff wear gown and gloves when they care for that patient, and obviously wash their hands when they remove their equipment, then you can prevent the spread. And this does work. Actually, we've done it at Somerset for 4 years now in our intensive care units. And we have dropped our rate of invasive MRSA to 0 in our intensive care units after several years of this process. So it can work
very easy steps to take, right? Very easy steps. You just have to remember to do them.
Correct.
Right. You know, we're going to move to Corey. Dr. Robertson, thank you so much for joining us as well today.
Thank you for having me.
It's becoming very clear, both from the media and from research studies, that it's no longer just a hospital issue. There is now something becoming more well-known as community-associated MRSA. Now, is this the same? You know, is this the same thing, or how is it different?
Staph bacteria and MRSA included in that is almost always spread through direct skin-to-skin contact. Now, people may come in contact with the bacteria through touching contaminated surfaces like gym equipment or soil bandages. Fortunately, staph bacteria aren't spread through the air. And one of the things I want to emphasize is that the environment, especially when we're dealing with MRSA outbreaks, is not thought to play a huge role in MRSA transmission. Okay. It's that direct skin-to-skin contact that plays the biggest role, which is why public health officials don't recommend closing schools for aggressive cleaning or sanitizing, as what happened during the fall of this year.
Okay, okay. So unlike flu that might be transmitted, we want to clean the doorknobs and clean our telephones and so on, you don't see that as being really much of the issue in terms of
the environment. In terms of community-associated MRSA, doesn't play a huge role in routine cleaning of environments. Should do a lot towards protecting people from coming in contact with this organism on some of those high-touch surfaces. Now,
I know there's a 5 C's that I've heard about. What might they be? And those sort of apply not just to the athletes and not just to someone who's had it, but just general precaution.
Yeah. Those 5 C's that you've heard about are essentially a way that CDC likes to communicate the risk factors associated with a MRSA infection. Okay. Now, anybody's at risk for developing a MRSA infection, but there are people in particular that are at higher risk of developing a MRSA infection, and those people are the ones that are associated with these 5 C's. Okay. The first C is crowding, and this is why MRSA is such a big problem in incarcerated individuals. Okay. Another risk factor is coming in close contact with another person, and that's why it's such an issue with football players or people who play contact sports. Right. One of the other C's that is often communicated as a risk factor is this notion of coming in contact with contaminated items, like the towels and the razors, that sort of thing. And a 4th risk factor associated with MRSA is actually coming into, well, lack of cleanliness, not practicing good hand hygiene is one of those C's. And finally, that last C.
Is that the compromised skin?
Exactly. And this is why it's such a problem in people who play contact sports. When skin integrity is compromised, it essentially serves as a port of entry for staph infections, well, staph to get into the skin and cause infection.
Well, those are all, things that we're all exposed to on a routine basis. So I think it's something we all need to be very conscious of, maintaining our skin integrity, and particularly in the winter with dry skin and cracks in the skin. Corey, let's say someone in the community, not a hospital-associated case of MRSA, but if someone in the community develops a confirmed case of MRSA, is that treated in the same way that Pat described earlier that the hospital would treat it, or is it differently approached?
Community-associated MRSA causes infections in individuals in the community. Typically, it manifests itself as a skin infection. Okay. Oftentimes, the only therapy that's needed is adequate drainage of the wound. Okay. There may be circumstances where antibiotics would be used, and the great thing about community-associated MRSA strains is that this type of bacteria is more susceptible to antibiotics that are commonly used in clinical practice compared to the antibiotics that are used to treat hospital-associated MRSA infections.
Okay. Now, some of them are sort of common, I think, that I've read about. Things like Bactrim.
Exactly. Bactrim, clindamycin, tetracyclines, rifampin. Those are the types of antibiotics that have been shown to be effective in treating infections caused by community-associated MRSA strains.
Great.